Thank you very much, Kiran, for organizing and directing all this very interesting project. I think we have 3-4 minutes for some hot comments or questions. It's open. Come on, work. You're not warm yet. So if we don't have something more, we can...
maybe if I can...
Yes.
Nobody said something, then I say something. Marcus, you didn't expect that, yes, you did. No. I can borrow your microphone. Oh, I take this back. No, I think thank you very much to all those who really invested into these projects. It's such a wonderful thing, and I really want to highlight also that this is part of the whole Galen core system of these Centers of Reference and Excellence initiative, which Marcus thought of. Some years ago, Ucare was the beginning, and I do like to see how this can be a roadmap to our other core projects which are lagging behind. Ucare is the very best of all now, but others are coming. AdCare for atopic dermatitis, ARIA Care, where a lot of been done in the past. So please go on with these projects and think even beyond, because we have to think in comorbidities also. It's the patient, it's not just one single symptom or disease we treat. We want to help the whole patients. We have many patients who have more than urticaria. They have rhinitis, they have asthma, they have atopic dermatitis, and this is what we really want to help all patients with allergies. So thank you everybody having invested in these projects, and think of more and beyond. Thank you.
Thank you very much, Torsten, and let's go to the next session. We've seen what we're doing right now. Let's move to unmet needs in urticaria, and I'll call immediately Ivan Seres to present the Sleep CU project. Ivan.
Okay, thank you again. Please. Our idea, we know different studies show us that the approximately 50% of the patients with chronic urticaria have problem during sleep. We know that sleep is sometimes attached to the symptom for a patient with chronic urticaria, and our idea is our objective will be measure or assess the frequency of primary disorder, sleep disorder in patients with chronic urticaria using a survey named Global Sleep Assessment Questionnaire. And the other objective is try to find if we have a relationship or association between this sleep problem with the severity and activity of the disease. Now we have we contact with the research who developed this questionnaire. We have the permission to use this, and now we are preparing the proposal about this. We have now preparing our sample size, and all of this part of the data analysis and how we develop or to prepare the service is in order to be in the future to contact with all of the Ucare members who are interested to participate in our project. And after we complete the manuscript, after we prepare the proposal, the first proposal, we send and we start a pilot study only in 20 patients and look for difficulties, especially in the language of the different survey. If you are interested to participate in this project, please send us an email, because we try to find if chronic urticaria is association with different disorder, sleep disorders such as insomnia, sleep apnea, parasomnias, restless leg syndromes. Thank you very much. If you have any kind of question.
Thank you very much, Ivan, and let me introduce Frank Simberhardt to give us what is CSU Plus, Frank? Just explain us.
Yes. Okay. Thank you. Yeah, thank you, Michael. Yeah, what is CU Plus? What do we mean with CU Plus? It's a new project I would like to propose to you. Obviously, this is probably something many of you have also seen in the patients. Many chronic urticaria patients report, in addition to their skin symptoms, on other symptoms while they are wheeling. So we have done an open survey in Berlin here, asked 100 patients, and we were quite surprised because 6 out of 10 were reporting on symptoms other than wheals they have when they have an acute episode of their chronic urticaria. This is different forms of symptoms, could be gastrointestinal, could be fatigue, could be headache, so many different things, not yet very well defined. And when we think about this, it comes close to something else, which comes from the Mastocytosis Society, which is MCAS, mast cell activation syndrome. So this is defined, as you can see here, as having mast cell mediated symptoms in 2 different organ systems, which then may be true. It's also defined by having an elevated measurable mast cell marker or release of mast cell markers like tryptase. We don't know yet if this is true for urticaria. And there's a response to mast cell stabilizing symptoms, which truly in urticaria is the case. So the question is, and regardless what we call it in the end, is CU plus a subform of MCARS? At least it is probably a subtype of chronic urticaria. And this we would like to better define in our big cohorts. So what we plan to do is we, together with you, would like to develop a questionnaire to better define these patients, also compare them with different things like disease history, duration, treatment response, other markers like disease severity, quality of life, check for the tryptase levels if there's something different in these patients having systemic symptoms or not, and other biomarker samples, and anything else you want to participate and put into this project. So if you're interested to join, please contact me, contact the Ucare office. We will also send out this proposal by email within the next days. And that's it. Thank you for your attention.
Thank you very much, Frank. And please.
Good morning. I'm Dr. Sendil Kumaran from Chandigarh, India. We really started out this conference well. This cold Turkish morning, it was really cold for me. So I had to put on at least 3 or 4 or 5 layers of clothes so that I can get accustomed to this cold. So I'll call in the next speaker, Sabina. She'll be talking on cholinergic urticaria.
Thank you very much for having me here. And I really want to raise awareness and also want to raise excitement for cholinergic urticaria. So we want to raise or start a project on cholinergic urticaria. There are many projects ongoing with chronic spontaneous urticaria, but not so much on inducible forms of urticaria. There's a wonderful project on cold urticaria, but I would really love to get more of the inducible urticarias also be more aware and more present at the Ucare. So cholinergic urticaria, I guess most of you know, is this disease with the very small wheals that come upon exercise or passive warming. It's often with extensive itch, sometimes also with pain, which is interesting, and it usually persists for many years. So there is a lot actually that we don't know. That basically was what we know. And now comes all that we don't know. We hardly know anything about prevalence. I just did a quick look. There are not many publications on the prevalence of cholinergic urticaria. That's even worse if you want to know about the world, what's going on in the world anywhere. Furthermore, the pathophysiology is not completely understood. It's even vaguely understood. So there are many concepts. It's not clear which patient could have what pathophysiological background. I really think we need to better characterize the patients maybe clinically so that we better understand the pathophysiology of those patients. When it comes to diagnosing, it's a little bit more more time-consuming to diagnose these patients. The question is, how are actually you diagnosing these patients? So you can either do unspecifically exercise, which is recommended in the guidelines. I do the more specific provocation test on a bicycle, pulse-controlled, because it allows better assessment of the patients. But we don't know, sorry, how you are dealing with it. Sorry about that. Okay. So, and the next question is, how are you actually doing the therapy in those patients? So we can, of course, recommend avoidance, then second-generation antihistamines, but basically that's actually it. We have no other treatment options for those patients. So, or at least no licensed other treatment options. So it will be very interesting how you are actually treating these patients. What are you doing if the licensed drugs are not working? Or do you have other experiences in that? So actually what we want now is to come you on board to that project, to let's ask the questions, let's put together a steering committee, and this is really the aim, or this is where the project stands now. I'm looking for people who are really also interested in cholinergic urticaria. I'm also interested in participants who say, but we in our country rarely see cholinergic urticaria patients. That also would be very interesting to see. Why is in your country this not so common, for example? So even if you think, well, I don't have so many patients, please also come to us. That's very interesting, yeah? So I really want, in my ideal dreams, I would like that every one of you who is here in the center also takes part in the project. And I'm here, the little red one, but I would like to become all of you taking part in that project. And this is my email address, so please take a note, or may take a picture and get in contact with me. I will also be here for the rest of the conference, also have some posters on cholinergic urticaria, so whenever you see cholinergic urticaria, come to me. I'm very interested. I'm very happy to get you on board of this project. Thank you very much.
Thank you, Sabina. Next, I'll call Petra. She'll probably talk on two subjects, both you, COM, and your child. Petra.
Good morning, everyone. And now I want to convince you to be part in our team. We want to know more about children and urticaria. And you all know we have a lot of children. Who of you is treating children in urticaria? Chronic urticaria children as well. And we always are listening to the people who say, okay, we have no children or no urticaria children or no chronic urticaria children. So we want to know more about those children. We have some questionnaires. We want to be part to create specific questionnaires for children, and maybe we can find some new comorbidities, some new reasons for the urticaria, and so we need you also to be part of our team. Maybe you can talk to me or my colleague and we can get in more details. Thank you. Next one as well. Okay, next one is something special. Urticaria combinations of therapies, and that's what we learned about from other diseases like psoriasis, like atopic dermatitis. We very often combine therapies, not only antihistamines and omalizumab, but combinations of other systemic therapies, and we don't know, and I think maybe you have some good ideas and we don't know what's going on worldwide. Maybe we find some new possibilities with old treatment options, for example, dapsone or other things, and what's about combinations. So we have a lot of patients, they have other diseases, they are treated for other diseases, and we want to be sure that we can combine some therapies. And therefore we thought about this project, collecting patient data worldwide who receive a combined systemic treatment management for chronic urticaria, but maybe with other diseases combinations as well. And we are very, very early in this stage, but we want to start very fast, that we can use this data maybe for our patient, and that's important. We have special questionnaires, of course, you know this, and we want to know something about dosages, comorbidities, disease durations, but also treatment durations, and of course adverse events, and so on. Thank you so much.
Thank you, Petra. Now I'd like to call Emek. She'll be talking on style and chronic urticaria.
Okay. Hello. This is a very preliminary study, so it's under construction. I'll be very happy to get your feedback on this project, and I'm also looking for steering committee members. Would be happy to collaborate with. So basically, in this study, we are aiming to determine lifestyle factors for chronic urticaria patients. Sports, diets, are they smokers? Do they consume alcohol? Do they consume caffeine? Do they take herbal drugs? These are the subjects that we are concerning about, and there is no information on the effect of occupation and maybe hazardous substances that are faced in the occupational setting, and other things like family history, systemic diseases that we all already know about will be the aim of this study. Here you see what we will compare it with patients without chronic urticaria, so that maybe we can define a prototype of chronic urticaria patient. So it's a prospective international multicenter observational study. We are now making the questionnaire. It now has 26 items. And plus this, there will be a simple lifestyle indicator questionnaire that will be given to the patient. We will include CSU, CINDU, or both patients who declare to have chronic urticaria for more than 6 months. And we will also have an age and sex-matched control group without a chronic systemic disease. We won't include chronic urticaria patients for longer than 2 years. So the questionnaire will include education level, employment status, the job of the patient. He or she was employed 5 years before chronic urticaria started, hazardous substances in the workplace, rural, urban, living alone or with partner, marital status, blood group, family history, other medical conditions, regular medicine use, on-demand medicine use, herbal medicine or vitamin supplements, psychiatric problems, sleeping problems, allergies, caffeine consumption, herbal tea consumption, and financial problems. So this is the questionnaire. And here are the questions. Yes, caffeine consumption and herbal tea consumption. And this simple lifestyle indicator questionnaire is a reliable, valid summary measure of lifestyle that would allow researchers to quantify lifestyle. So it will give us an unhealthy, intermediate, or healthy score for the lifestyle of the patients. It consists questions on diet, on physical activity, alcohol consumption, smoking, and life stress. So the study will continue till the predefined number of patients that we will define later, and we are looking for steering committees and steps to be taken for this project, establishing the steering committee members, adding other relevant questions. I'd be happy to get your ideas, testing the questionnaire in a target population, establishing the last version of the questionnaire, getting ethics approval, and announcing via Ucare emailing list and website. Thank you for your attention.
Thank you, Amit, for that interesting project. I would like to add one question here. You can use people who are using hair colors also, because hair dyes are known to cause contact urticaria. So probably you can add that to it, because that's also a lifestyle, because most patients nowadays use hair colors. Next, I will call on Heike.
And finally, I would like to introduce just startup project, also just in a startup period. And this project is called DRUSO, Determinants of Omalizumab Drug Survival in a Long-Term Daily Practice Multi-Center Cohort. And I think this is a project really needs a big network. Otherwise, none of us can make such a project alone, or maybe in the next of 10 years. What is DRUSO about? We have at the moment a very nice team working together on this project, but we need project members working on the data. Daily drug survival analysis is about the difference between daily practice data and randomized controlled trials, which is not comparable, as we all know, since daily practice gives us insights in real-world effectiveness, reason for discontinuation, duration of treatment, and determinants of treatment. And drug survival analysis is a very good method to analyze this. This is a comprehensive outcome analysis covering effectiveness, covering safety, and especially patients' and doctors' preferences. So shared decision-making in the doctor's room you all need would really influence how long a patient is treated with a specific drug. And here we talk about omalizumab. And you can also differentiate drug survival by different reasons for discontinuation, as well-controlled disease, ineffectiveness, side effects, and combinations. I just want to give you some data we just published this year, and we also presented last year in Berlin, to give you an idea what we want to do. And this is a study made with just a few patients, 140, and we need really more. And here you see that drug survival in this population over a year is 77%, and we also could differentiate this by reasons for discontinuation. But this study, and there are a few more studies, is, the next slide is that we also can analyze determinants of drug survival. So you can look whether age or sex or the specific subtype of CU influence drug survival, and we also have done this in this study. And here we saw that CIndU is a very important, CIndU was the only one, the only one determined who could influence drug survival in this study. And a big disadvantage is that this is a monocenter study with just 140 patients. There are 2 other studies on drug survival with a few patients. And also the number of events in such a small study to analyze variables influence drug survival are too small to have enough power. So we need another study to look what is the drug survival in daily practice, and this daily practice period is post-marketing period. So now we're in real world for this drug. And we can evaluate drug survival in a large multi-center cohort. And large means 1,000 patients in my mind. And then we have a good study. And hereby we can determine also different reasons for discontinuation. Is this well-controlled disease? But more important, is this side effects? Not just in small studies, not in randomized controlled trials, but in real-world studies. And this will get real data inside safety and effectiveness. And we also can see whether there are country-specific differences, and we can see whether protocol-specific differences on drug survival. Just a few words on the method, because what are we looking for? I talked about 1,000 people, 1,000 patients in this study. We look for centers which are able to provide data of the whole population treated with omalizumab they have. And for this study, we need not just 1 or 2 patients from the population, we need the whole group of omalizumab treated patients for this study, without any selection, without any bias. This is really hard, this is really difficult. The good news is we don't need all the data about all these patients, but just specific data we need for drug survival analysis. And this is a very limited table of variables, but we need the whole population, to be honest. And yeah, I think this is the most important for now. And if you think this is interesting, I would like to contribute in such a huge study, then come in contact with me. Thank you.
Thank you, Ray. I hope I have pronounced your name correctly. Now we have some time for discussions. Anna.
Yeah, there is a comment for Petra, for the UCOM, because you mentioned we will check combination in order to get more effective treatment in our patients with new and old drugs. And also you mentioned how safe is use our drugs in combination with other drugs using for other diseases. And this is for me a very important question, because we commonly receive questions from the other departments in our hospitals. If it's safe combine omalizumab with rituximab, if it's safe combine omalizumab with anti-neoplastic drugs, and we normally answer is safe, but we need more data on that and answer the information in order to get a good answer for our doctors. I support your project, but we should go a little bit fast on this, because there are common questions in our daily practice.
Any more questions?
Thank you very much. My question to Emek about the chronic urticaria and the lifestyle. That's a very interesting project. And probably I missed the herbal contribution, whether this is a binary question or this is like an open question, because, herbs are quite diverse. And, you will be astonished when you see the herbal sort of practice among Asia, India, sort of, Middle East. I have many patients who are surprising me on a daily basis, probably contributing certain herbs or spices with efficacy or with response of urticaria symptoms and control. So that will be an interesting part to capture in your study. So I don't know what's your thoughts on that?
Thank you, Mona. Actually, I have many questions. If I go in that much detail, so I will be lost. Maybe if we find something in this, then we can go for further examination.
Refining.
Yes, Kiran.
Dr. Kiran.
Well, congratulations with so many data, so much thinking. Well, one important question which we face in our ethics committee is when we share our patients' data to an international website where it is secured or not secured, whether the data is preserved. These are the questions we often get, because data, patients' privacy is important. And when we are sharing this data, in fact, the QR study, we have to stop it because we could not get the ethics committee approval for sending our patients' data. So you need to find a solution. One, whether your server is served encrypted, there should not be leakage of that data to anybody else, even to company. So these are some questions which we face, and I could not answer to my ethics committee, and I could not join few of the projects for the same reason.
Kieran, and maybe Carsten can also add on this, because he certainly has the biggest challenge with a global registry where the data are entered from any computer on this planet, and that's why we need a very secure system, and we do have a very secure system. As for ethics committee approval, the leading team, the applicant team for each project will have to secure ethics approval for the primary center, and will provide this ethics approval and all other documentation to the Ucare website, so that Laura can put it on the member area. And all of you who have contributed to projects already know the procedure. You go there, you use it for your own ethics committee approval if you need to do that in your country, and then you move forward. As for data protection, there's no question, we need to do this. We need to follow the rules. And my suggestion for those of you who are interested in launching new projects or who are right now working on central databases is to talk to Ivan, talk to the Uverzico team, talk to the projects that have already gone through this process, so that you know how to handle the data. In essence, it is very good to work with a central database, but this brings data protection problems. So one way to do this is to work with anonymized data that you enter at your center, that you bring to the central database at the principal investigator center, so that it is then consolidated to be one data bank. And this is usually accepted by the ethics committees.
Yeah, can you give like a lead, somebody is leading that project in writing, that this data will not be shared with any company or any of the other projects or any of thing. If you gave it in writing with a stamp and this thing, that this will be only secured for that particular thing, which we could submit to our ethics committee and saying that this is secure data only for that, and it will not be shared for any other projects also, and not even any other things.
Yeah,
so that
that's
will
a very
help us.
good point. Laura is already writing it down. We will work on this in the Ucare office. Thank you.
I too had the same problems in my institute, so that was the only reason why I couldn't join most of the things like that. No more questions? Then we'll, one more.
Thank you. It's just a comment to Ivan. Ivan? Here we are. Because you've showed that it's from the previous presentation that you had regarding the apps and Facebook and YouTube and those. So then at the end of your manuscript, you will recommend us to change our daily clinical practice and approach to our patients? Because it seems that the behavior that we have now is completely different than what they want.
Yes, we are now analyzing all of the data, but our idea, our next challenge is to recommend how we measure or how we send information, how you develop apps in order to be useful for the patient with chronic urticaria. Because sometimes we prepare web browser, we have a good ideas to create web browsers, but nobody explore if the patient considers useful of that. We know when we analyze all of their data, probably we work together with the engineer who developed this app or web browser. Because for our opinion, we have in that moment in a conflict, because we think our physician, the younger people, the millennium engineer, think about young people. And sometimes they are not a physician. And sometimes when they develop app or web browser, thinking about how it's difficult to think how we are a doctor or what is the field of the patient believe. And now when we work together with the engineers, probably we develop better web browser or app useful for the patient.
Here we have one question.
Thank you. I would like to ask Monica about the Gold Urticaria project. There is an age limit of 13 years and up. And I was wondering why younger children are not included in that. Because if we were, to register children with Gold Urticaria, then there might be an overlap because children are from until 17 years of age. So I don't really know why this age limit was decided. Yeah. No, to Moicha with the Gold Urticaria project, but if there is any other suggestion to that.
Moica, can you address this? The questionnaire is 13 years and up.
Now, when we were making questions about antihistamine treatment, we made two groups of patients because I think there's the only question about the age group under antihistamines, but we wanted to include children.
Okay, because there is, in the project plan, it is stated that the questionnaire is for children 13 years and up. And I already, emailed why is this age limit.
I don't know, I'll check this, but I don't know, that surprises me.
Yes.
Because we wanted
Please
to
do.
include children. We'll check it and we can discuss it later.
So it might be, something
Maybe
that
it was
is.
the patient questionnaire that we thought that children could not answer. I'll check
But
it.
it is applicable to children also.
Yes, of
so
course we want to include
there
children.
shouldn't be any problem. Okay,
Yes, let me please check
do
it
that.
and we can discuss it, of course. Thank
course.
you.
Just supporting her because there are two phenotypes of cold urticaria such that start with very young people and such that start during their life. That it's just.
Any more questions?
Just a comment to Kiran about the Urticaria book. It's an excellent work, so congratulations. Now, this is already published, but are you thinking of an electronic version to sort of have it more of available for the Ucare members on the website? And I think that's going to be like an ongoing with a periodic maybe update from global centers.
Well, there is a lot of excitement about the Ucare book. There are many people who send me email afterwards that I wanted to join. We try to get as many as possible. But well, as on today, it is on sale and it will be on soon on Amazon and ZP Publisher site. So I can get a PDF, but not now immediately, but maybe after 6 months to 1 year, when Ucare interesting case part 2 will come, and the part 1 will be for PDF. So as on today, it is not there. But personally, I can send you, any of you want a PDF, those who want to, but we can't give it on the website because it is on sale by JP and it will be at all the major conferences, the JP has a stall. So you can go for it and it's not highly priced.
Petra, just to say, we are doing a project with the IACI, and you and I are both part of the IACI Pediatric Chronic Urticaria Task Force, I being the secretary. We've already had 294 responses to our questionnaire from the IACI community. So we hope to send it out to IACI as it was generated by the IACI membership, but then we hope to send it out to Galen members as well. So if you are members of IACI, please look out for this questionnaire. As I said, we've had a fantastic response within 2 weeks of it being declared. So please be part of this. Thank you, Petra.
No more questions means then we will close this session. Thank you very much, the organizers, giving us an opportunity to chair this session. Thank you very much. Wonderful morning.